Hi there, folks. Jan Kaminsky here again. So this week we wanted to take a couple minutes to talk about misgendering. So misgendering is when you deliberately or accidentally use the wrong pronouns to refer to a patient or client. Now that can go for anybody, but it specifically concerns us when we're talking about our gender diverse patients and clients for whom misgendering might be something that's really, really painful and damaging to your provider-patient relationship. So I wanted to talk this week in the vlog and in the blog about 5 things you can change right now in your clinical practice in order to improve the relationship and improve your use of pronouns in your clinical setting. So the first thing is ask patients what pronouns they use. That's a very basic way to establish respect and make sure that you're using the correct pronouns. Make this a regular part of your clinical practice, not just with patients who might look like they need to be asked what their pronouns are, but any patients. Make that part of the medical record, make it part of the paper record, the electronic record. Depending on your EMR system, that can be added in. If you do misgender someone, don't apologize briefly, but don't belabor the point and keep going and make them feel bad about the situation, even worse than they are already feeling. Just apologize briefly, use the correct gender and use the correct pronouns, and keep it moving. Next, you want to think about adding pronouns to your staff and provider name badges. So name badges are a very easy way that all of your staff and providers can demonstrate that using pronouns, affirming pronouns in your office is a very important part of your clinical practice. And it's simple to do. Your name badges or your name tags or stickers or whatever they use in your office simply have your name and then below that pronouns. And then you can either write in your pronouns or you can have them pre-typed in there for staff who are there every day and using a consistent pronoun. Oh, that's something else I wanted to mention. Some folks may change pronouns as they move through their process or even on a day-to-day basis. So it's important to check in with your patients and clients and see if the pronouns that you have recorded are still appropriate and valid for what they're working with. Also, another quick tip is to save some gender-neutral words to use in a pinch. So words like folks or y'all are good for groups of people. If you don't know somebody's pronouns, you could use the pronouns they, them, and theirs as a stopgap measure until you know their pronouns to avoid misgendering anybody. So take a look at our blog today and start making some of those changes right now in your clinical practice to avoid misgendering your patients and their family members as well. All right, take care. See you next time.